All right. Hello, everybody out there in social media land. I am Dr. Kent Key, and we are the Flint Public Health Youth Academy, where public health is everything and everything is public health. We are so excited to be back on the platform and to be with you, our listening audience, again. We have a very interesting show. We have two segments today. What we want to talk about in our first segment is kind of give a summary reaction to the last 3 or 4 shows that we focused on long COVID to kind of get our interns' reaction, what was new information they learned, what was things that kind of stuck out to them, what was shocking, what was not shocking, and get their reactions on that. And you feel free to put your reactions in our comments. And then the second segment of this show, we want to talk about some very current contemporary issues that we're seeing across the country related to gun violence. And so again, we are excited. Before we get started, I'm going to ask you, and even before I introduce or let the interns introduce themselves, pull out your phone, go to your social media, like and share this page right now. We're going to give you a couple of minutes to do that. So let everybody know that Flint Public Health Youth Academy are on the air live and in living color. Give you a couple of seconds, like and share. All right, everybody liked and shared? Okay. All right, so we want to talk about first what's going on with our interns. Give us some updates. What's new, what's popping, what's hot, what's not with you? Go ahead and I'll just kind of start off. I'm gonna just pop it around the who I see. So one of our mentors, Jasmine Hall, go ahead and take it away.
You just said kind of what's new. Oh, well, I would say a focus on, I'm like in my world specifically, we're really focusing on like race and ethnicity and how do we collect this? How do we make sure we don't have as much missing data? So that's something that's really kind of top of mind for me. And I know there'll be a lot of conversations across the state this summer, getting input on how we should do this.
Awesome. And I'm going to swing it over to Everett, one of our interns.
Hello, everybody. Like Dr. Key said, my name is Everett. What's really new in my world is just I'll be graduating high school here in about another month or so. So getting ready to kind of dive into getting prepared to go to college and start a career. So, yeah.
Awesome. Exciting times, exciting times. All right, intern Kayla Shannon, what's up with you?
Hello, everyone. My name is Kayla Shannon. What's up with me right now is this cold that I'm kicking. But as well, I am about 3 weeks away from finishing my degree, not graduating because I am sticking around for another year, but really excited to be wrapping up. And I presented my senior thesis today, which was great. And I also recently began hosting the Green Table Talk, which is hosted by the Black Millennials for Flint in partnership with the Environmental Defense Fund. And you can find that every 4th Thursday. And so really excited to participate with them as well. So that's what's going on. Send healthy vibes and prayers my way.
All right. We have mentor and staff Monisha Summers, Dr. Monisha Summers. Go ahead and greet the people. What's new with you?
Hi, everybody. Sorry, I can't turn my camera on right this moment. I'm driving, but something new with Me, just working on a research project dealing with antibody testing in COVID and just taking a spin. We're doing within the community after people get booster shots. So that's a new project that I'm working on. After a person gets a booster shot, we're trying to get them enrolled in our project. So that's pretty cool, and I get to lead that project. So pretty exciting.
Awesome. And I see Cole Mays is in the house. Intern Cole Mays, what's up?
Nothing much. How are you guys? Okay, so honestly, like it's been kind of a jam-packed week for me. I don't really like I don't want to have like a gigantic like all right, let me restart. Okay, so freaking we just got a cat. We just got a new cat, and he's in our freaking bathroom right now. He's chilling because we just got spayed and neutered, which is freaking cool. Second, I am continuing my YouTube channel, and it's honestly getting pretty good. And I possibly can fix my car could possibly be fixed sometime this week, which is freaking cool.
So the car is awesome. The YouTube channel is really awesome. And the cat chilling in the bathroom. That's,
Yeah.
I'm telling you, that's outstanding there.
Yeah.
All right, Tomas, intern Tomas, how are you?
Hello, everyone. Hello, my name is Tomas Teo. It's a pleasure to be here with you all today. And it's been a ride, but it's been a very inspiring ride. But man, my fuel tank is on E. I need to charge up, get that unleaded. But yeah, I just was on the road today, for real, no pun intended. I was college touring. I'm stuck between MSU, Western, and CMU. I just left CMU today, so I'm really just trying to see. That's right, Jasmine, fire up chips. So I'm trying to see and shout out to Jasmine too, because she's really been instrumental in helping me with this college process, and just to everyone else, whether you shared me a piece of advice, any question, like it's really what really greatly appreciated. So really thank you, and just continue to pray for me because I'm so indecisive. It's like taking your crush out on a first date. They don't know where to eat. Me, I don't know where I want to go to school. So just pray for me, and yeah, best of wishes to you all.
So Tomas, just a hint and a word of advice, holla at your boy Everett. Hint, hint. All right, Seema, what's up? Tell us what's new with you.
Hey, my name is Seema. What's new with me is, so after I get out of school, for this summer in July, I got accepted into a art college program at Stamps in Ann Arbor. So I'm going to be gone for 2 weeks by myself without my parents and everybody, surrounded by strangers, but I get to like have like a college experience. So I'm gonna be in a dorm with people I don't know and be on campus. So that's scary, but it's cool. So that's like me getting closer to becoming like a tattoo artist.
Awesome. All right, Taishay, say hey. What's
Hey,
up?
nothing much. I just got done getting pricked and poked. I'm tired. I started my new job and finishing up this college semester. So that's pretty much it.
Well, that's enough. Awesome. Awesome. Christian, man, what's going on with you?
Hey, how's it going? A lot, some legal stuff here and there. My birthday's in 2 days. That's pretty cool. Turned 20. Just got a new car again. I can't hold a car for more than 6 months apparently. But other than that, I'm just hanging around, just still working hard, still going to school, all that good stuff.
Awesome on the new car and awesome on the birthday in a couple of days. All right, the one and only, there could only be one because the earth could only deal with one. Melissa Mays, what's going on? Our mentor.
Yeah, I wouldn't recommend there be more of me. Just a lot of work in the community for the pipe replacement program here in Flint with the 9th anniversary coming up on Tuesday of the water switch. We've just had a lot of community education, outreach, and information gathering that we will be also sharing within the next few weeks to get more community input and everything like that to make sure the program finishes up as it should. And yeah, so that's been a big, huge part aside from all the other chaos that is, living on this planet right now. So going great.
Awesome. Then we have the administrator of administrator, the Reverend Dr. Sarah Bailey. Say hey to the people, Dr. Bailey.
Hey to the people. Tired. I spent most of the day yesterday traveling back from Washington, D.C. Was able to present at the Clinical Translational Science conference this year, and it went very well. I think my panel, I think we rocked. We did, because we community and we tell the story. We tell the truth. And it went very well. The posters went well too. The poster presentation went well. But I'll tell you what, going out there to DC was smooth sailing. But y'all know that confusion and stuff that we had going to Boston, I had it coming back to Flint. And all I could say is, I want to come back. All I want to do is go home. All I want to do is just go home. Would somebody please get me a plane that will go home?
But it was a different type of confusion because y'all didn't have a pilot.
No, we didn't have a
So that
pilot.
was the issue. And I would rather you be on the land in the airport than in the airplane without a pilot. All right. So if I had to pick, that was the best, but I understand. And I crack up with Dr. Bailey talking about they were rocking. Somebody actually texted me and was like, did you see Dr. Bailey's Facebook? She was like, yeah, because y'all don't want no smoke. Dr. Bailey is the only person I know with gray hair that uses the modern day lingo better than I do. So y'all, you should have told them at the airline, Dr. Bailey, y'all don't want no smoke. Get a pilot up in here.
I did. That's how come we ended up with a plane out of there, because they was telling us tomorrow.
The next day. Okay.
The next day.
Wow.
I was like, that ain't happening. No,
Wow.
no.
Dr. Bailey said, don't play with it.
Old people revolt. You know that we do sit-ins and stuff like that.
So y'all sat in. All
We
right.
sat in.
So I know I said that we had a show today that we were going to divide into 2 segments, but it would be remiss for us to not insert one segment before we get started. And that is what Melissa brought up. We are the Flint Public Health Youth Academy. And almost 9 years ago, the water in the city of Flint, Michigan was switched, not by Flint, like many of the headlines said, but by an emergency manager that was appointed by the then sitting governor of the state of Michigan. And so on the 24th of this month, in a few days, we will be reaching our 9th anniversary. And what we want the world to know is Flint still ain't fixed. We have gone, and when I say we, meaning many in our community, have gone to help when the water crisis broke out in Jersey, when the water crisis broke out in Jackson, Mississippi. We have gone, we have been consultants, we have been guides, we have partnered because we did not want people to go through what we have gone through. And places like New Jersey, their situation is fixed. And another thing to remember, audience, is that ours was not like many of the other water crises where there was a natural failure of infrastructure. In Flint, ours was not caused by a natural failure of infrastructure. We were the first water crisis in the country to happen because of a man-made decision and where a whole community's democracy was stripped from them, where all authority and power was given to the emergency manager via the governor of the state of Michigan. So I always want to put that in context. So just right now, for those of us that are from Flint, whoever wants to chime in, let's talk about it. Like for me, it doesn't even feel like 9 years. Sometimes it feels longer than 9 years. Anybody want to just speak to the continuing and ongoing water crisis that we're going through right now in Flint?
I just always want to add that Flint is the only city this has happened to where this basically our clean water was taken from us by decision and not by local decision, not by our choice, but it has been prevented from changing, and it's been fought to keep it this way, with us using the less than wonderful, less than safe quality of water, and now destroyed infrastructure by politicians and everything like that, which means things can be changed and moved, and it takes a lot of work. And there has been an amazing amount of work done by the residents of Flint in the courts, in the streets, and legislature, ballot boxes, all of the things, and that hasn't stopped, and that is inspiring so many other communities that we've been working with. It helped Benton Harbor get fixed in about a year. It's helping, we're helping with East Palestine right now. We're helping with a lot of different communities, and to show them that your voice matters, your life matters, but also the people have a lot of power, and it's not a fast fix. It's not an easy one, but when your life's at stake, you got to do it. And so we're working to help prevent other people from having to deal with that, but also to help them realize that you do matter. Every single voice matters. And then we're seeing our youth come up and being brought up in this crisis, and they're doing such amazing things, and they're fighting such big issues, but they're naturals at it, and they're coming into it not as tired as the rest of us, which is great. And the residents of Flint, the youth here, have just done amazing things and are going to continue to do so. So I think out of all of this seemingly never ending 3,283 days, I think it is now, it's amazing to see the wonderful things that have come out of it. So, and a lot of them are right here.
Awesome. Tomas?
Yeah, thank you, Dr. Key, and thank you, Ms. Melissa, as well. Just as you said, it is indeed not an easy fix, and the issue still remains. I remember I was in a focus group about a couple of months ago at MSU, and some students voiced their concerns on how the water filters, because now everyone in social media land in Flint, a lot of schools and facilities, different institutions, businesses have filtered water fountains where you just, they have like a little light indicator. Green is good, yellow is it needs to be changed soon, and then red is like, nope, don't drink it. And I remember at Carmen Ainsworth about a couple months ago, unless it was addressed, I remember that they had theirs on red, and sometime that was very concerning. Another student, I don't remember their school, but they didn't always have access to water bottles. So I definitely think that though, of course, we want more solutions than just water bottles. In the meantime, people have to drink, that's a human right. And I feel like more concern and more, more effort should be dedicated towards helping people, kind of get the leg up the fence, in the meantime, whenever it will be fixed. Of course, there's many years of trauma that's still going to take recovering from. But in the meantime, I just wish that there was more focus on helping us youth in the schools, and even not just us youth, just citizens, period. Because, that's just what we have to do. We see a lot of great economic development, specifically downtown, which is wonderful. And I support it. At the same time, I just think before certain people in power decide to create new institutions and new resources and services, they need to focus with the number one resource, which is that water, So I definitely think that before we expand into creating other amenities in the city, definitely the water needs to be priority. And I'm sure definitely having these dialogues, I'm very hopeful that indeed will happen, but it just takes a little bit of a wake-up call. And that's no shame at all to anyone who is participating in that economic and land planning and etc. Kudos to them. Being that catalyst to change. I just really strongly recommend to help encourage the change with the water as well, and how resources are dispersed and etc. But thank you.
All right, we're going to go Seema, Cole, then Jasmine, and then Taishay.
So with the Flint water crisis, it's like some people think like the whole thing is gone. I know that some of my siblings think that it's gone, so they think it's okay to drink out of the sink, which it's not. Since I also work at a water testing lab, so we're still getting people with high levels of lead and copper in their water, and they're just going ahead drinking it, even if it comes out when we collect it, it's white, like it's a white or brown, and it smells like chlorine or something, and they think that it's okay if you just let it run for a couple of minutes. People tend not to replace their filters because they think that it, like, even if it runs a couple of days past, then it's okay, because they don't think it's that bad. But it depends on like the level like where they are, because it's higher in some districts than it is in another, but it's still safe to have like a filter. People who were like highly affected by the water crisis, like for me, when I was for the water crisis, I started getting rashes on my body. I have a bald spot, so I am kind of bald. That's why you see my little comb over. Um, and I started getting these dark spots on my eyes and white rashes on my face. And nobody, I didn't know what was wrong. I thought I was a freak because nobody else looked like me. So after we found out what happened, my mom was trying to figure out what she could do because she knew it was the water, but I didn't know what was going on. But they kept on saying it wasn't the water. So I feel bad for everybody who was like affected by it and like they're just not doing anything. Like, yeah, filters will help, but that's only for a certain amount of time. If we don't actually deal with the actual problem instead of trying to put a band-aid on a leaking pipe, then what else what are we going to do? So
Preach, Seema. I love it. I love it. Cole?
Oh, Jasmine was gonna go before me.
Oh, you can go.
Oh, okay.
I'm sorry. I'm sorry. Yeah.
Oh, okay. So 9 years, man. 9 years. You can start out from liking chicken nuggies to indulging yourself in corporate smack within those few years. No, long years. And it's just such a shame because it all wraps around, placing business in front of human life and just the loss of value that we assume. Dang, I freaking blood sugar's low. I freaking woke up early. All right. But yeah, it is a big shame though, because it's like just an inability to value human life when money's involved. And yeah, that's pretty much all I have to say.
And that was the impetus of the water crisis. Go ahead, Jasmine.
Right. Whew. I just want to say I can appreciate everyone's comments. Like I definitely see a lot of positive things that have come up in the last 9 years, but also speaking to what Cole and Tomas was kind of saying, like there are services and specifically water that people are not getting access to when it comes to what we need. And there are also a lot of long-term concerns, like kids' ability to be able to, have their adaptive skills and, ADHD and things that we know are tied to lead, although there was more than lead in the water. And one thing that I've, as a neuropsychiatric epi, that I continue to harp on, frankly, is kids are not getting access to their neurodevelopmental assessments that they are entitled to. Out of the 5,800 kids who have had referrals to get their assessments, only 500 kids have gotten them 9 years later. And the kids who were in utero or to under 6 are 8 to 15 now. Like there needs to be more accountability, much stronger accountability to make sure that as Flint residents, as people who are exposed to what the government did to us, we are getting the services that we need and properly. Because like we see a lot of money and resources are flowing around, but how often is it actually impacting people? How often are kids getting to understand, okay, what's going on with me and what services will I need and what services will you ultimately provide to make sure Flint kids can have the best outcomes possible? So accountability. And I'm glad that we're keeping the conversation going in everybody in every lane, because I know with some of the conversations I had this week with work, it's like, hey guys, what are we doing? And specifically around child neurodevelopment.
So you said neuropsychological, what did you say, something epi? And I want you to say it again because you said epi and everyone in our audience may not know what epi means.
Yeah, so I studied neuropsychiatric epidemiology, and I'm able to, so epidemiology is being able to analyze data, looking at trends in diseases and things like that. And neuro is kind of like brain, and how our brains work. Psych is more like our mental health. and kind of how are we doing. So being able to analyze data around that, whether it's, you know, who's getting access to these services or what do we know when we do these assessments. And what we know is at least 50% of the 500 kids who've had their assessments have ADHD. We don't know what the other, I don't know, 19,000 kids in Flint are experiencing or who are exposed, you know, are experiencing, but we need to know and we need to act immediately, and 9 years ago immediately. So yeah.
Absolutely. And I just wanted you to clarify that because I know we know a lot of these terms because we do public health every day, but you know, we want to make sure that our studio audience, and you're absolutely right. Jasmine, that is something that we have to do some continuous advocacy for. And it's more so a shame that we have to advocate for that.
Mm-hmm.
Yeah. Taisha and then Cruz.
I forgot I was muted for like a split second. So I wanted to say, commenting on, because Melissa made something, talked about doing another show. She also said that, you know, since the government loves to downplay, then I feel like one of the main reasons why we don't test our children is because the more the government, the more people downplay the situation, the less likely we're like, you know, yeah, I think we should check. The less likely we want to do that. I don't know if anyone's been to Mott or goes to Mott, but like I don't see any water fountains in there that are available to use. They all have this little red little cup over it with a little lock. And I don't know about y'all, but getting water after a long time of not drinking water, it feels so good. And I would love to be able to have access to running, you know, nice filtered running water. But the fact that my community college, a college that, you know, is pretty well known, still hasn't really taken care of the water fountain situation there, makes me think again that they don't do it because of the downplay of people going, you know, it's been in the past, it shouldn't affect us now, when it has affected us all day, every day of our lives.
Thank you. Cruz?
To think about it being 9 years ago is really hard to imagine almost. And maybe I'm gonna use the excuse because I'm young. It doesn't feel that long ago. But to think about it in that type of way feels so weird now that I'm getting older. But imagining, like, I can remember all those different things of like what life was like during then. And I still have a lot of those conversations, especially because I've, you know, moved out of Flint. And so to me, it's still like something that's really active and apparent. Like when I go and talk and discuss about, you know, environmental justice and things like that, and I mention that I'm from Flint, the conversation immediately moves to that. And so for me to like now just sit and put like a milestone next to it, like next year it'll be 10, a whole decade. It's astonishing to just now continue to recognize it hasn't been resolved yet. And it's really disappointing. But it also proves how much damage you can do to a community if you aren't intentional, and if you don't have their input. And we can see now how lasting that impact is, because like Jasmine was saying, we truly don't understand a lot of how this is going to continue impacting the city. We've noticed how now there might be some correlations with behavior, and then in concept with that, people are now potentially creating more prisons and all those aspects. But we haven't just sat to just interview and investigate and understand how this has truly impacted us in a objective way. And so now it's like, it's defeating almost. Like now that we're almost at 10 years, it almost feels like, I said almost a lot of times, but it feels like this is not something that can be managed anymore. It's grown so far out of hand. And unless it is like a whole lateral change now coming from the top as well, and not just the people, we're going to continue seeing and having these type of problems. And I don't think it'll truly be resolved for the residents of Flint. But it's, all in all, it's really disappointing to put a year and a milestone attached to it.
Absolutely. Everett, I'm sorry, Tomas, then Everett.
Thanks, Dr. Key. Yeah, kind of piggybacking off what Melissa said and Taisha about having like another youth dialogue where we discuss the water crisis. I suggest even like one of the not infomercials, but the infographics, pictographs that we had about how to go about utilizing alternative sources of water whenever a boil water advisory occurs. Because I remember, because I attend U of M Flint, and when the boil water advisory happened recently, I know that, I believe, correct me if I was wrong, that wasn't lead in the water, that was just a water main break. But still, it's scary. Water, the reputation that Flint has. So students were panicking. They're like, what do we do? What do we do? And I kind of had to be the savior to be like, here, I have some information from, here, the Flint Water Rising and Melissa and other people. So like, here you guys go. And people really appreciated it. So I still know that there's some people out there that might not know what to do. And I think that would be a really good proactive step to take. And shoot, on another note too, I don't know about you all, but it's just annoying. I mean, it's small, so I can get over it, but I just get annoyed when people always come to me and I tell them I'm from Flint. They'll be like, oh, where you from, Tomas? And they're like, oh, like they won't, like if people say, oh, how's the water? Like, are you okay? That's fine if you're empathetic. But if you're like, oh, I don't want to go there, they got the dirty water, I don't want to go there. That's just like so annoying. So like, what are your guys' thoughts about that? Like, what is a good, because I can think of a lot of responses, but they might not be the most friendly or empathetic back. But I mean, I keep the peace. But it's just my pet peeve, because I'll be like in Ann Arbor or different places and they'll be like, oh, where are you from? I'm like, oh, I'm from Flint. And then they'll be like, oh, I don't want to go there. They got the dirty water. They're nasty there and this and that. Like, I'm not the one that switched the water. Like, why are you? But I'm always going to own like Flint. Though we've had our fair share of struggles, I'm proud of where I'm at. You're never going to hear me saying, oh, I'm from Detroit, I'm from Grand Blanc. That's not going to come out of my mouth. Flint is where I'm from. So what do you guys, how would you respond to that?
So Tomas, really quick, because we're going to go to Everett and we got to switch over to the next subject. Well, just remind them, do a Google search of all the other cities that have had water crisis and say, oh, well, if that's how you feel about Flint, what about 1, 2, 3, 4, 5, 6, 7, 2? And you just kind of throw it back. Say, did you know all these other places had water crisis too? And where they are, if they don't check their infrastructure, at some point it's going to fail. So that's how I tell people. Go ahead, Everett, and then we'll circle back.
Yeah, I just want to say, like, sitting here listening to everybody else, like, give their like how they view. It made me realize that like 9 years ago, I was 9 years old. Like, that's half my life. Like, that is literally half my life. And I'm sitting here thinking, I'm like, well, what was life like before the water crisis? And like, I couldn't really give you an answer to that, like, simply just because I was 9 years old, when it happened. And I can remember sort of kind of like hearing about it, and they're just like, I don't drink the water. But I didn't realize how big of an impact that had, because like anything you do for 9 years, you become a professional at. I've been not drinking the water for 9 years. Like, I'm a professional not drink the water. And just thinking about how it altered like my brain. Like, I don't go, when I travel, I don't just go and be like, okay, well, let me drink something out the faucet. I'm always like, where's a water bottle? Like, give me a water bottle, show me where your water filter's at. Like, I'm never, I'm never gonna just drink out the water faucet. Like, and that's just how my brain is wired, because coming from where I come from, we can't just drink out the faucet. And then like thinking about how, like Tomas was saying, like people kind of come at you sideways when you tell them you're from Flint, and they say, well, how's your water? What happened with the water? And they kind of expect you to give them a rundown of everything. And I'm like, I don't know. I genuinely, I don't know. Like, they just told me not to drink it one day, and we haven't drinking it for 9 years. And just how like mentally that affects. Like, it's people that I know, like from Grand Blanc and from Davidson, that wouldn't come, hang out at my house because they were, worried about the water affecting them. And it has affected a lot of people. But just thinking about, how much time really has passed, and how much like mentally, this water crisis has like weighed on me, and how it's kind of changed the way that like I interact with the world. So
absolutely. So listen, y'all, this has been, Dr. Bailey, I see your hand, I think.
Yeah, you did.
Okay.
And I'm just listening to everything, because we were back in the thick of it, having to deal with it from the fact that what do we do about it, and then dealing with how do we change the narrative, how do we change how people look at us. And I hear some of the issues that we were anticipating are still floating around, but it is troubling that even when I was in Washington recently, it came up. It's gonna come up because we've had so many other traumas heaped on top of that we've had to deal with. So it really makes it bad. But I was listening today when the president was talking about making sure that all of the lead pipes throughout the United States are removed. And I said, does it have to come to the fact that before we can get ours fixed, everybody else in the United States is going to have their pipes fixed? And we're still struggling because all of our pipes haven't been replaced yet. And because even though we know everybody doesn't have a filter, don't use the filter properly, like SEMA says, and bottled water is an option, we don't even want to pay, our politicians don't even want to pay for us to have bottled water.
For free.
And water is a right.
For free.
For
Yep.
free. It's
Well,
a right.
Yeah.
It
bottled
should
water
be
for
a
free.
right. It's not really for free because the citizens of the city of Flint are still paying for water that cannot be purposely used without going through the two-step process of filtering it and then boiling it.
Yeah.
Because the bottom line is that if you boil it and you don't filter it, the lead is still in the water. The heavy metals are still in the water and they can still affect you. That water does not test all the time free of lead and free of heavy metals. It just
Right.
doesn't.
Right. And I just wanted to add that because, the last couple of months, there have been a lot of the water distribution places in Flint were at a point to where they did not have the resources coming back in to provide free bottled water. And that's why I was saying that when your statement. But I would like for us, as we transition to the next segment, when Dr. Bailey says all the pipes are not fixed, all of you in social media land that don't live in Flint, that was one of the eras that the media broadcast that was in error. They used the word pipes. When we say there was pipe replacement happening, which is not complete in Flint, we're talking about service lines that bring the water up to the house. But there are no provisions in place to replace people's in-home plumbing. Residents have that financial burden. So the same water that polluted the service line pipes also polluted in-home plumbing pipes. And that burden has been placed on the residents of Flint to replace all of their in-home plumbing pipes. And I don't know how many people y'all know that just got an extra however many thousands of dollars it costs to get all your piping in your house repaired. So I just want to put that in context for those who don't live in Flint. So as we transition, and we're going to come back, we're going to have another show to kind of talk about post the 9th anniversary. Probably be our very next show where we'll continue to talk about what happened on the 9th anniversary, because everybody is coming in. I know Melissa, myself, Dr. Bailey, we've all been getting calls from reporters to do interviews because people want to know about what's happening on the 9th anniversary. But I will say this. So for the last 3 or 4 shows, we really focused on long COVID. And for us, it was a direct connection with water and COVID, because we were still trying to make sense and trying to get on a road to recovery from the water crisis when COVID hit. Now you have a whole city that cannot really use the water unfiltered, yet one of the requirements to be COVID-free is constantly washing your hands. So you have people like an Everett, people like a Tomas, people like a Cruz who are like, hey, I've been kind of socialized not to deal with this water, right? But then you got the government saying, but you got to constantly wash your hands if you don't want COVID. And so water was a necessity in one of the avenues to combat COVID. So I wanted to just kind of lay that as we kind of go into this whole long COVID conversation. I see your hand up, Everett.
Yeah, one, the long COVID conversations that we had were just very eye-opening. The concept of long COVID was something that was presented to me for the first time when we started talking about it. I was aware that people had long-term symptoms and issues following having COVID, but I wasn't aware that, there was a label for it and that, there were people working to sort of reverse it. So one, it was extremely eye-opening, and just getting to hear, we did the show where we had people who came on who are experiencing long COVID, and just hearing like their stories. And then we had like Dr. Vereen come on and give like some, some facts and stats on it. And that was just very eye-opening. But going back to what you were just saying, Dr. Key, dealing with the pandemic and dealing with the water at the same time was just an insane sort of situation to be in. And it makes me think now, like what effects would it have for someone who was dealing with lead poisoning, who got infected with COVID? Like what kind of is there anyone looking into that sort of thing? Because that may be another reason why people are experiencing these long COVID symptoms or are having like a hard time following COVID, just because of the simple fact that they already, had contaminants in their body and already were, continuously being exposed to these things when they have to take showers. Because, I just said, like, I don't even like using the faucet water, but that didn't mean I just didn't take showers for 9 years. Like, I still had to take showers, and I just had to, have faith in the fact that they were telling me they were fixing stuff and that stuff is okay. And, by the grace of God, and luckily, like, I just never had any super bad issues when it came to water, and like rashes and stuff like that. And I'm grateful for that. But knowing all the people that did, like what affects, I feel like somebody should look into that as well, specifically about Flint, because there's got to be some overlapping issues there coming up directly from a water crisis, not even coming from it, like being in a water crisis and then being in a pandemic.
And I think Jasmine, can you say what you just put in the chat too?
Yeah, that's something I think about too. And I see Melissa talk about, she's been screaming about it too. Cause it's like with COVID, there were some symptoms of long COVID that are related to brains. You have memory issues, brain fog, confusion, all type of other symptoms. Then there's also like organ issues. And I know with lead, there's that, kidney connection, like that connection to kidney disease. So it's like, we got to do something, like, and make sure people have access to the screenings they need, access to services, like everything. We got to do better.
Absolutely. Anybody else want to mention your reaction to the long COVID series that we put on for the last 3 to 4 shows? Anything impact you, or aha moments, or yep, I knew that?
I just wanted to thank you because when I first found out that I was diagnosed with long COVID, it was very similar to when I first found out that I was poisoned. Nobody wanted to acknowledge it. My doctor did. So that was awesome. My doctors, my specialist did. I mean, it took a while to get the answers because the testing is very difficult, especially when it's been going on for a while and all the conflicting information from the government versus the, the medical community and everything. Yeah. So the fact that I had, over the years, I'd finally gotten to a place of consistency with my, working through and living and coping with the poisoning in my body. Then all of a sudden COVID just pulled the rug out from it. But it was the same, it was going through the same thing. There's something wrong with me. It's not right. Why can't I shake this? Things were going wrong. Why do I have asthma now and I didn't have that before? What's going on with my heart? I didn't have issues with my heart rate before. And then having the list, I have to print out now a list of all of my conditions and medications whenever I see a doctor, and which is constantly multiple times a month. So it's a lot. It's a lot to fight through. And for people like me, we don't like to say, there's something wrong with us, and everything until we're yelling and screaming to get services and help for other people. So, it was, it's something that people need to see, especially directly impacted communities like Flint, who've been poisoned in the air, water, soil. And then you have a pandemic like this comes along. We have a compromised immune system or a suppressed immune system. I mean, in 2020, we had a 12.5% case fatality rate in Genesee County, in Flint, because we have a lot of immunocompromised people. We lost so many amazing people because of this, but it wasn't big news because, other things that the media wanted to cover and people had Flint fatigue and didn't want to talk about it, or the connection between what happens when a pandemic hits a poison community and stuff. So I appreciated the series and the kids learning about it and the public learning about it. So this has been amazing. And then I just sit back and just kind of nod, and I'm like, and I hope other people did as well who are going through it, because, we're not alone. And, it's something different to finally be acknowledged with the things that you've been suffering through and trying to get help for. So yeah, I just appreciate the series that's been going on, and our team and the youth's input. It's just been fantastic.
One of the things that stood out to me was, and we had a couple of comments of, I'll read the comments that people leave on our show. And one person, this wasn't real, long COVID wasn't real, and there's still deniers out there, right? And so I don't really put a lot of energy in the deniers, because most deniers don't become believers until they're the ones in the hospital on a ventilator. And so, I just don't have the energy for that. But I will say this, all people still don't necessarily believe that COVID was real, even though those numbers of deaths were real. And again, just for those deniers who still want to argue the fact that this was something that the government made up, right? COVID deaths worldwide, okay, are as follows. And I think I gave the numbers before. They're very high. So COVID deaths worldwide, well, first there were, oh my goodness, almost 1,120,529 deaths worldwide, and over 102 million confirmed cases. I'm sorry, that's the United States. That's the United States. Worldwide, there were 6,908,000 cumulative deaths and 763,740,000 cumulative cases of COVID. And that's looking at the World Health Organization, the WHO's website right now. So, I mean, I'm not going to argue when the numbers are what they are, but again, it's important that we continue to educate each other and our community on long COVID, that there are symptoms even after you're no longer testing positive. There are health issues, like Jasmine talked about, the brain fog, the confusion, the dizziness, respiratory issues, all kinds of issues that we talked about on those shows that are symptoms of long COVID. So if you are having, in our studio audience, health issues that you didn't have before the water crisis, that happened after the water crisis, you might want to consider that they could be linked to the water crisis. At the same time, if you're having issues that you didn't have before COVID and you're having them now, you might want to check it out because they could be linked to long COVID. One of the things I think Melissa and Dr. Bailey were talking about is that so many people in Flint died around the water crisis time. And people were saying, and I know there were some documentaries that were on television networks talking about conspiracies, because we had a just peak of individuals dying on their death certificates. It said pneumonia-like complications, but there was not that many dying from pneumonia-like complications before, right? And so you want to think about these things, like it's just not happenstance. And so again, for those of you who had not been able to see the videos, you can go back on our YouTube page at FHYA, FPHYA 810 on our YouTube channel. We archive all of our old videos there, or just scroll back on this page here on Facebook and you can just check it in the title. You will see that we're talking about long COVID. and the impacts of it. And so we want to continue to keep that information out there because people are still impacted. Well, for the next 9 minutes, we want to take a launch now into some current events. And these events have been happening all the time, but have been definitely flooding the news media more recently. And that has been the number of shootings and gun violence related activities. I'm going to just open up the floor and let y'all talk, because I can narrate this, but I want to hear what y'all thoughts are on these most recent and gun violence episodes we've been seeing flooding the media. Tomas, then Everett.
Oh, I'm about to enter my soapbox stand, but I know we have 9 minutes, so I'll keep it brief. But I don't know, it just continues to just frustrate me because some of our adults, educators even will they'll try to say, oh, this is terrible, it's horrible. But then when we students try to do something proactive and propose a solution or just something we can do other than because, ladies and gentlemen, I don't know about you, but it's becoming a norm. And writing a condolence card is needed. And it's definitely something that needs to be done, but there's more that needs to be done on top of that. I know I said needs to be done a lot. I'm going to work on not repeating myself, but I just, I wanted to be proactive, meaning Melody here. And just, we had a little bit of pushback at first and trying to do something at our school, you know? And it was just frustrating because the same people that are like, oh, if you need support, we're here for you. When us students come to try and get that support or work to support other individuals, then it's crickets. Nothing happens. It's a bunch of excuses. And I really want to see just people that actually listen to us youth, which is why I'm really appreciative of FIA for giving us this platform. Luckily, fast forward, we were able to push for it. It took more than just me. I tried my best, but we ended up doing an organized school walkout. And on top of that, we gathered index cards. And I challenge you, anyone out there, whether it be a workplace, school, wherever it may be, age does not matter. I challenge you to, just on a note card, not postcard, but a note card, just sticky note, write it down what you think would improve school safety or gun safety, and then mail that to your local legislator in your state capital or even in DC. Mail that to them, and hopefully you can play on the heartstrings to them, you know? So that's what we ended up doing. We collected some index cards with how students think that school safety should improve, made it anonymous, made it very neutral so politics and polarization wouldn't occur. So that's just what I challenge you all to do.
So we're going to go Everett, Taisha, Cruz, and then Seema in that order. Then we're going to wrap up the show and we will continue this gun violence conversation in subsequent shows. And we will be launching our gun violence prevention campaign, health messaging campaign this early spring and throughout the summer. Go ahead, Everett.
Yeah. Well, I want to start off by just saying one is very scary. It's growing up in Flint alone, I've always been weary about, where I go, who I'm with. And it's crazy now that school is no longer a safe place. Church is no longer a safe place. Going to pick up your siblings from a house is no longer a safe place. Like just being outside in general is starting to become no longer a safe place. So it's like every time, I go to hang out with my friends, I always got that thought in the back of my head where I'm like, well, let me make sure I'm watching where everybody's doing out here, because every single day it just gets closer and closer to home. You think that only time you would ever have to worry about this type of stuff is when you're at war. But it's people who are in their own front yards playing basketball who are being shot at, being chased. So it's just crazy to think that like there is no safe place when it comes to crazy people with guns or people with guns in general. And I agree with Tomas was saying, like, we need to get together, and it's going to take a lot of, the little groups, but the more little groups that we can get pushing this message, the more that the people in charge are going to be forced to, listen to us and react. Because the idea that all these shootings keep happening and they continue to occur and nothing has been done yet. Like not one thing has changed. They proposed giving the teachers guns or upping the security in schools, but that hasn't stopped anything. That hasn't them proposing that and not implementing anything to change hasn't, you know, and the things that they are talking about change are just dumb. Like, why would, what sense would it make to give teachers guns? Like, I saw
that's
this.
the solution, right? To give more guns to end the issue with guns.
Yeah. And like, I saw this teacher who was like, you know, it's crazy that the government is ready to give me a school issued Glock, but I'm going to go purchase my own pencils and pens and paper for the class. Like, they're ready to give me a whole weapon, but they won't give me, you know, the extra desks that I'm asking for, or the iPads that I'm asking for. So it's just insane that the priorities of the government are so focused on not taking guns away, but they rather give more people guns because they think that that's going to stop the issue. So it's just crazy that we're in an age where the government is so bent on making money and not helping the people.
Absolutely. Thanks, Everett. Tasha?
So first off, both of y'all are awesome geniuses. I agree with the whole, challenging people to come up with ideas for their safety and the school as well. So I want to say the company I work for a security company, and the security company I worked for was founded on, funny thing, security for schools. It was basically just a group of people who did safety walks and stuff at school. And the fact that we actually have to have so many security people at a school blows my mind. Yes, it's okay to have security there, but what I think they should do is have stricter entrance to the building, proper checks, because if you make sure the doors are locked, have better doors to where it can't just be shot at and it can be opened. You can probably protect more students with that than a security guard, 1 or 2 security guards with a singular gun. And the fact is, it's scary. I have a niece who will be starting school next year, and with us just having to do tornado drills, the fact that everyone now has to do school shooter drills blows my mind. I don't want anything to happen to my niece. I don't want anything to happen to my nephew. And it's like Everett said, it's scary. It's super scary. We should not have to worry about this. We shouldn't have to fear for it. But here we are. But again, I feel like better ways to keep people out and better safety measures for when you want people to enter the building should be more implemented.
Absolutely. Cruz and then Seema.
Once again, it's just another moment that's disheartening, disappointing, leaves you dissatisfied. We've discussed about becoming desensitized a lot in our talk shows, and eventually you expect it to stop, like that these things won't continue going on, or at least if they want to go on, they might still be, rare. But that's not what it's been. If anything, it feels like it's been happening more prevalently. And before you can really rationalize or cope or come to a point of closure for the first one, 2 more happen before that happens. And so it's just really disappointing, honestly, that no action happens. And it's frustrating because we can blame it on money, which a lot of it is. But the other aspects of it is the blatant disregard for the people that they're supposed to be representing and serving. Because even now, there's been a recent congressman, and I don't mean to come off negatively to them, but they didn't care about these type of issues until it happened to their family member. And it shouldn't have to be that way. Truthfully and honestly, things shouldn't have to happen to you for you to be empathetic or sympathetic to the people that they are happening to, especially when your whole role and job is to be concerned for people. And so another element that really disappoints me along this is because it happens so largely to youth, like for example in schools, but these are also people who can't vote. And so then it's not only that are their voices being stripped and they're put into places that aren't deemed safe to where they have to do things like drills, they can't even push against it. And when they do, and when congressmen actually respect and affiliate with them, they're punished. And so you just sit there and there's no way to feel positive about it. Like there's obviously an issue here and people are just chosen not to take it seriously. If this was something that would just blow over, it would have done so already. But this has been a problem for our country for a very long time. And it, like I said earlier, it hasn't decreased, it only has increased.
Absolutely.
And so it's just, like I said, it's really disheartening, really disheartening. And the fact that we can't truly feel safe anywhere anymore, and to raise children in a society like that, I guess it only just reaffirms why we have some of the other issues we do have, like race.
Thank you, Cruz. Seema?
Okay, so first I wanted to say that even at my school, now after all these school shootings, everybody is so cautious. There'll be random people walking by the building and you'll see the police standing on the corner. Some dude was handing out Bibles a couple of days ago and he walked into the building and we had to be very cautious of like what he was doing in the building in the first place. They were standing outside all the buildings, out at the doors, at the parking garages, so we didn't know what was going on. Everybody is scared because these shootings are happening in for what reason? The students inside, they don't know anything. They don't know what they did. If they did anything, most of the time they didn't, and people are just shooting at the schools for what? Fun? Like it doesn't make sense. And then people who are like the last shooting, there was one in Nashville, I believe, with hold on, because I don't want to say anything that's like incorrect. Yeah, in Nashville, her name was like Audrey Hale, and she had like ADHD and she was like high on the spectrum. And now I see that people like kids that like little kids who are on the spectrum, even at FCC, they're being cautious. They already have bars on their school. They have the police, some kids are being patted down because just because one person did a school shooting who's high on the spectrum, every other kid that they suspect is on the spectrum is being patted down by their security and being checked to make sure that they don't have any weapon. They are little kids and they're just treating them like they're grown adults, thinking that they're going to have something to shoot up the school with. Kids, like, it makes no sense. Like, this is just being projected on everyone, even little kids, adults. And even if it's not their fault, they go into school thinking, why is this happening to me? What did I do? When they had nothing to do with what happened and what somebody else's decision was.
Yeah. Thank you, Seema. And one of the things I want to do as we get ready to close out is one of the things that I'm having issues with, and we will explore this in other subsequent shows, is always putting the shooter's behavior and just classifying it as they had mental health issues. Because most people who I know that have real legitimate mental health issues and diagnosis are not going around killing up buildings of people. And I think it does a very injustice to those who are really struggling with mental illness. And it's the difference between having mental illness and somebody pissing you off or you not getting your way and you not knowing how to control your temper. Those are different situations, right? And so we wanted to have some discussions to kind of distinguish that as well. I keep seeing Mason, who is Monisha's son, and we love Mason. I remember when she first started working here at MSU, she was pregnant with Mason. And I'm loving that he's in this frame, because this is why we do what we do, because we want children like Mason to be able to grow up in a world better than what we were growing up in. And so oftentimes I get asked, why do you keep fighting this public health fight, trying to address inequities and disparities and the isms, racism, sexism, classism, ableism, all the various isms? Because I want kids like Mason, if we can make the trail a little bit easier for them, then we've done our part, right? And so again, we just want to thank everybody for tuning in today. I know we added that Flint water crisis segment in because we're coming up on the 9th anniversary. And we also discussed and did some reactions to the long COVID shows that we've done for the last 4 or 5, 2.5 months, 3 to 3 months. And then we're kind of leading into this anti-gun violence prevention campaign that we'll be doing this spring and summer. So we want again to give you all information out in social media land, let you hear perspectives of young people because they have voices, they have solutions, and they have ideas and mechanisms that maybe some of the older generations don't have. And we want to also encourage you all to be advocates, to write your legislators, to write your congresswoman or congressman on both the state and the federal level, and to make sure that your voice is heard. So again, we thank you for joining us for another episode of A Youth Perspective. I am Dr. Ken Key. We are the Flint Public Health Academy, where public health is everything and everything is public health. You all have a good evening.